What are the most common conditions that patients encounter that brings them to a neurosurgeon?
So I will introduce two terms, flatback syndrome and text neck syndrome.
One thing that we get to hear now is a lot of cases of Parkinson's, Alzheimer's syndrome.
There are medically treatable causes of this, and then there are some reversible causes.
So social media versus neurosurgeons. If you wear collars or posture correction belts, all neurological issues can be fixed.
Absolutely wrong. It's not based on science.
Hello and welcome to the News Minute. This is Real Talk powered by Apollo Hospitals, Chennai. And joining me today is Professor Dr. Anil Pande, Senior Consultant Neurosurgeon at the Apollo Hospitals, Chennai. And today we are going to discuss about a complex subject. So thank you so much for joining us.
Thank you.
For someone who has never met a neurosurgeon, what exactly you do? And is neurosurgery always about brain surgery?
Neurosurgery is about the surgery of the neuraxis, that is the brain stem, the spinal cord, and the peripheral nerves. So it is a huge specialty, or the surgery of the nervous system. A brain surgeon is a short form of the neurosurgeon's actual repertoire. Nearly 70% of our procedures are actually spine procedures.
So what are the most common conditions that patients encounter that brings them to a neurosurgeon?
The commonest reason why a patient walks in today in our practice is severe back pain or neck pain. So I will introduce two terms, and the first is what I call a flat back syndrome. That is, if you sit like a couch potato or you sit like a bag, then your arch, which is protecting your back, that becomes flat. And this syndrome is called a flat back syndrome. Similarly, small children who have big heads sit with their cell phones, and then they are getting what is called a text neck syndrome. So these are the reasons why you commonly come.
That brings us to the next question. Like, when should people stop ignoring these symptoms? Like, for example, you said headaches, back pain, which are extremely common, right? Like, how do you differentiate?
The differentiating factor is the intensity of the pain. If this is the pain which you have been getting, the headache you have been getting for years at certain periods of time when you are stressed out. But if it is a thunderclap headache, a thunderclap headache is the worst headache of my life. There is imperative urgency that you immediately go to the neurosurgeon and get a scan done. And the scan is generally a CT because an MRI does not pick up the blood. So people have a tendency to say, go to the MRI. No, it should be first a CT scan because blood is not seen well on the MRI.
Okay, so we live in an Instagram era where everything is out there on Instagram. You know, the companies that sell pillows and sleeping mats, they give you ortho advice. The companies that, sell belts and bands or like, posture correction jackets or something like that, they all have things to offer. They can give you something that even doctors wouldn't suggest. So why it makes things very easy, right?
So now point is, why are neurosurgeons spending time, liaising with IIT and trying to find out this? It is because the complexity of the spine and how it protects the nervous system is very large. So by doing any of these shortcuts, by a mattress, in what way a mattress is going to help you when your muscle tone, your basic body's muscle tone, whose function is to keep your nervous system and your spinal cord intact and to cushion you. So it's like a cable bridge, you've seen a cable bridge?
Yeah.
So the concrete and the road is not the strength of the bridge, it is the cables. And in our case, our cables are our muscles. So touch your abdomen, touch your back, touch your neck muscles. If the whole body tone has become poor, the chances that you will injure your discs and create severe pain and problems is very high.
So what are the kind of technology that's being adopted or implemented in these surgeries and how successful they are now?
For example, even for my lumbar disc, which is considered by many, I don't consider it a simple operation. There is no simple neurosurgical operation. But even in a lumbar disc, when I operate at OMR Apollo, I use neuromonitoring for every case of lumbar disc, and that has improved my results because the nerve root irritation. In fact, the common adage is don't get spinal surgery done, some problem will happen. So, neuromonitoring. So, neuromonitoring used to be earlier used only for spinal tumors, but now we use neuromonitoring for nearly everything. So, we monitor the function of the nervous system while we operate. We use image guided surgery. So, we use the preoperative images, and these images are fed into the computer, into our navigation systems, so that while we operate, we know exactly where we are. That means we are 5 millimeters away from the main internal carotid artery.
And talking about AI, you were mentioning about Atlas. How does that help you in performing surgeries? What does Atlas do?
See, a lot of times there are certain pathologies which are rare. Every individual's tumor is different. Every aneurysm is different. So it's called the complexity score. So now if we see something which we have not seen, or there is a doubt in my mind, then I talk to my peers, I discuss with my students, and now we have this resource called Atlas GPT, or these are AI tools which allow us within matter of second to review the entire literature. Yes, there were 3 cases which were seen in Japan or etc. And then they tell you how to enter. So they will give you a plan also, which obviously you will evaluate and then apply. But it is a remarkable thing because that will tell you that you can use this entry. It can tell you also the amount of complications you'll have. So you can prepare. It says that the tumor is very vascular according to this thing like that. And then we make sure that we are ready with blood. We embolize, means we block the blood vessels to the tumor before surgery. So as you can understand, all this is a night before the case. We sit and study what all we should not do or do during the operation.
So this tool is built by experts
It's
from
built by
across the world.
neurosurgeons. Neurosurgeons in
Various parts of the world.
academic centers.
Doctor, also talking about issues related to neurosurgery or neuroscience. One thing that we get to hear now is a lot of cases of Parkinson's, Alzheimer's syndromes. What are the signs that one should not take it very lightly?
Thank you so much for bringing this, because although I'm not a neurologist, all neurosurgeons like to call them surgical neurologists. So there are a few conditions which are called reversible dementias. They are called reversible dementia. The Alzheimer's is a type of dementia. Fortunately, we do not have this in our country as much as it in the West for so many reasons. But one important thing is, if you have a father or an uncle who is suddenly confused, who has had a minor head injury and he has developed weakness on one side, it is not necessary that it is always a stroke or it is dementia or it is old age senility. He can have a subdural hematoma. There is a collection of blood between his dural, that is the bone, and his brain. And that is outside the brain, that is causing pressure. As soon as that operation is done and this is taken off, the person becomes normal. So, there is another condition. That condition is called normal pressure hydrocephalus. It's a very, very common condition. It has 3 findings. Person starts forgetting things. Person starts having difficulty in walking. And person becomes incontinent. Incontinent means is not able to control his urine. So now this triad, if it is there, definitely before we label the patient demented and ask the psychiatrist to see, there should be neuroimaging and there should be a neurosurgical consult so that these reversible dementias are taken care of. You can have craniopharyngioma, the tumor which is sometimes found in the elderly people, that also presents as dementia. So now you get my point. There are medically treatable causes of this, and then there are some reversible causes.
So now we'll move on to the next segment, which is one of my favorites, facts versus myths. A neurosurgeon only treats conditions that require brain surgery. Is that true?
No, it's not true, because spinal cord, peripheral nerves, we operate on vagal nerve tumors, we operate on brachial plexus tumors, we operate on the complete spine, cervical, dorsal, lumbar. So complex spine, CV junction of the spine. So I think it's an oversimplification to call us brain surgeons.
If you have frequent headaches and migraines, you should see a neurosurgeon.
Yes, because you have to rule out something structural, something that can be taken care of. Young people can have AVMs, AV malformations. It has to have some red flags, but yes, down the evaluation, if the headache has been giving you a lot of trouble, I think a neurosurgeon should be involved.
Once you have slip disc or severe back pain, surgery is usually the only permanent solution. Is that true?
No, it's not true. We operate only on those patients who fail conservative management. Those that, so initially we are actually encouraged not to write an MRI, get x-rays done, and treat the patient symptomatically when there is no neurology. So we examine the patient, check the patient, put them on conservative management, teach them that you improve your body tone, you reduce this thing, learn to sit support without support. If after that it doesn't work, then we image the spine and then we offer. So spine surgery is not an easy thing. And if you notice, the common adage is don't get your spine operated on, you can get into problems. Because yes, it is so complex that you can get into so many issues. And however brilliant I may be as a neurosurgeon, certain percentage of my patients will have complications. So we should never do an operation which is not safe, and we should never do an operation which is not indicated.
So brain surgery always involves opening up of large part of your skull, and when it comes to recovery, it is going to take a very, very, very long time.
The wrong. I don't agree with this. It is an era of minimally invasive neurosurgery. So we have small incisions which we make through the eyebrow. We have access through the eye itself. So we have small craniotomies. That means very small openings. And sometimes we are discharging patients 2 days after the surgery. We do the scan immediately. So that has really changed. So it is an era of minimally invasive neurosurgery. In fact, all of current neurosurgery is minimally invasive. It doesn't mean that every surgery has to have an endoscope in it. Endoscope is approximately about 20% or 15%. In 5%, some people may use an exoscope. But in 90% of the cases, it is microscope which is used along with navigation, along with neuromonitoring to enter the brain through very small corridors, precise planned corridors to remove the tumor. The brain must not know that we came and we went.
Okay.
It's called the bank robber's approach to tumor surgery.
Money
The
heist.
bank robber has to enter without anybody knowing, has to exit without anybody knowing, and the bank must be empty.
That's a great way to describe this. A brain tumor automatically means cancer, and it always needs immediate surgery.
No, there are many brain tumors which are benign. There are some brain tumors which are incidental. So there are some tumors called vestibular schwannomas which are very small. In fact, one of my close school friend's wife has got 2 tumors, and I have been observing her for nearly now 22 or 23 years, and they have not grown. So we have not touched those tumors. So that is one. Some tumors are incidentally found. You had a head injury, you did an MRI, a tumor is picked up. So these are called incidental tumors. Like the pituitary can have sometimes a little large pituitary. These incidentalomas we don't operate, and there are large number of benign tumors. Again, I am another editor of a book called Meningiomas. We have a very large experience with these benign tumors. They are there, they can be removed, and with outstanding results. In fact, I operated on a young girl. She was in 12th standard. Now she is doing her engineering, and she's planning to do her master's in the US. And it took me 17 hours to remove the tumor. So we call this retractorless surgery. So we do not retract the brain. Through small openings, we go and keep on removing the tumor. And they're very vascular, these meningiomas. Then you have tumors which come from the hearing, our hearing apparatus. So that people can get some noise in the ear. Those are called vestibular schwannomas. These are all benign tumors.
So after brain surgery or a spine surgery, patients can never completely return to their normal life.
No, absolutely wrong. And our aim, even in malignant tumors now, is called functional neurosurgery. Functional neurosurgery is, we also call it hybrid neurosurgery. So we remove the tumor as far as safely possible, and then whatever tumor we feel is a lot of risk to remove, that part we treat with what is called gamma knife. It's not gamma knife, it is focused radiation, one-time focused radiation, or cyber knife, what is available in Apollo here, is the same thing. So this is what is today's world neurosurgery. It is functional neurosurgery. I had a patient whom I operated second time for a glioma on the dominant side, and he was an IT expert living alone in the US for nearly 5 years. So he may succumb to that surgery, to that tumor after 10 years. But 10 years of good quality life is possible. And in a certain significant percentage of patients, we cure them of their malignant tumor.
So social media versus neurosurgeons. If you wear collars or posture correction belts, everything can be fixed. All neurological issues can be fixed. As a neurosurgeon, what is your take on this?
Absolutely wrong. It's not based on science. It's not evidence based. Evidence says that the biomechanics have to be taken care of. By just putting a casing around this, you are not taking away the problem. You are making the problem worse. The problem came because the biomechanics was faulty. By using a lumbar belt or a cervical belt, you are making those same muscles weaker. You are spoiling the normal curves of the spine. And I personally feel that there is no role, and a lot of education should go into the thing that recreate your spinal arches, recreate your muscle tone, and get back to life. So that is very, very important. In fact, I have operated on a very senior neurosurgeon, one who was involved in my training. And he is playing in tournament level tennis, 77.
So posture related issues are irreversible. We have to learn and live with it. As a neurosurgeon, do you agree with this statement?
No, I absolutely disagree. Any habit. So I tell every patient who comes with the back pain and neck pain that don't want you to come back again to me. And if that is so, you must learn to sit like a yogi. You must learn to sit like a yogi. You must make sure that your arches are there. I have a huge poster showing the arches of the spine. Recreate those arches. If you are obese, lose weight, because that is a not good chance. It is 100% guarantee that if you follow this for about a month, as the media will say, that it becomes a habit. So you have to be convinced with the information behind this that you have to recreate your normal biomechanics. You have to re-strengthen your muscles. Is it possible? Yes, 100% of the time.
In media, we say if you watch a program or a show for a month, it becomes a habit. Yeah,
that's true.
Right.
I think I agree.
Thank you, doctor. Thanks for joining us and giving
Thank you for having me, and thank you for your time. Thank you so much.